Hi, I'm Dr. Casey with Birmingham Health. And for people that have been experiencing any type of sciatica, degenerative disc disease, any other type of bulging disc, or just chronic low back pain, today we're going to go over 3 lumbar stretches and hip stretches that's going to help you start getting you relief to those areas. So we're going to start going over 3 of our lumbar stretches, and the first one we're going to go over is the piriformis muscle. Now, to know what to know about this is that your piriformis muscle is attaching from your hip and going up towards your low part of your back. So you're going to get a good hip stretch and a good lumbar stretch. So for patients at home, what we'll have them do is start laying on their back. And the whole goal is that you're going to try and bring your knee up towards not just your chin, but opposite shoulder. So we'll bring the first knee up. And as we see, we'll bring the knee up towards the chin, and then we're going to start bringing it over to the opposite shoulder. And then we're going to slightly push in. And what our patient should feel is a light stretch kind of in this region, or maybe kind of going back more towards the part of the lumbar spine. And what you do is you hold that stretch for about 5 or 10 seconds. You'll kind of relax down, and you'll go back into it 5 or 10 seconds. And after a period of time of repeating that, the muscles in the piriformis should finally start to calm down, giving you some low back relief. And then we, of course, would go to the other side. And you might feel one more on one side than the other, and that's okay. Just make sure you still give it equal attention. The next one that we'll do is that we're actually going to bring the leg off to the side of the table, so the patient would slide to the end of the table here for me. That way the leg can kind of slightly hang off a little bit. And then we're just going to take the toes and slightly point them outward, and the patient should begin to feel a stretch kind of in the upper leg or maybe in the low part of the back. And you hold that stretch for about 5 or 10 seconds, and then you relax down, and then we'd go back in and do it again. The other type of stretch you can do is bring the toes inward, and now we may feel a similar style of stretch in a slightly different area of the upper leg and lower back. And again, we will repeat that for about 5 or 10 seconds until it starts to give us relief, and then we'd go to the other side. Now we're going to sit on up, and we'll just turn this way for a second. The last stretch is one of these deep low back muscles, and it's one that's usually missed a lot of times. And what we're going to do is show you how to stretch this one out. It's called the Quadratus Lumborum. It's a very deep low back muscle that you should feel somewhere generally in about if you had your hands on your hips just like this. So what the patient's going to do is they're going to slightly turn to one side, and this is going to help us start stretching this first side here. We're going to slightly lean forward, and then we're going to lean away. And then we'll take the arm, and you'll come across like this, and you should feel it not just in the oblique section, but also down here and deep into that low back muscle. And then you can kind of twist a little bit to feel that slightly different, and that's going to help you start stretching your Quadratus Lumborum. Now again, repeat that for about 5 or 10 seconds, and then of course we're going to go to the other side. And again, we'll turn, we're going to slightly lean, and then you'll start to lean back with arm coming across. And again, you should feel it not only just in the oblique section, but really deep into that low back muscle. Well, I hope that these stretches not only begin to help you get immediate relief, but I hope they continue to give you relief later on down the road when you need it. If you find yourself still stuck in that same pain pattern, don't get discouraged about it. Keep doing these types of stretches until you can seek professional help. And if you're looking for somebody that does non-surgical techniques and also practices without any type of non-addictive medicines, that's our specialty. And if you're in the Birmingham or Hoover area, we'd be glad to help you guys out too.